Everyone, I will quickly show you a sequential order of Achilles tendon loading, and you can use that with your Achilles tendinopathy patients, insertional and mid-portion Achilles tendon. You can actually use it a bit for Achilles tendon rupture also. So what do you need? You need this type of piece of wood, and then you can have a decline board and a jump stretch. Cable poles, but you can use burglar bars. You don't need a specific tailor-made cage, and then a stopwatch. So in this, we will quickly talk about the isometric loading as the sequential order. Isometric loading will start off then with, say for instance, my insert is on my right, and you will go up and try to keep this position for 30 to 45 second holds. So this is extremely good for Achilles tendon calf activation, not specific increasing the capacity of the tendon, but this is for activation purposes. How do you increase the intensity of this? You can intensify it by pushing down with your first ray, your big toe into the ground with a bit of plantar flexion. Then you can try to uproot this pole, and you can use now a 60, 80 or 100% maximum voluntary contraction, and you keep it in this position. So this is extremely good for loading the gastrocsoleus plantar fascia. You create with the foot stiffness, and you get that Achilles tendon to work really very well hard, and you can build it up from 15 seconds to 25 seconds later on to 30 and 45 seconds. Or you can move, you can actually increase the intensity in a different manner, where you will have a bar there, and you can lift, you can use a bit of hip flexion now. So now what I'm going to do is I'm going to push really hard up, and then I'm going to use my hands to uproot this pole from the ground, and I'm going to push through my right foot, and there we go. 6 seconds, 8 seconds hold, keep the maximum 100% maximum voluntary contraction, and relax. Very important, no jerking. So it's a 1 second up to 2 seconds. Get to that 100% maximum voluntary contraction. Keep it there, push down, and you can do 5 to 6 repetitions. So this is the isometric loading of the Achilles tendon calf complex. Then what you can do is you can go for the eccentric loading. So this is not a hierarchical order. I'm quickly going to show you with minimal equipment what you can do to load the Achilles tendon. Then you can use a jump stretch, and jump stretch over my shoulder. Then maybe 2 up, lift, eccentric down. So now you can decide with insertional tendinopathy, you're not going to go all the way down. You're going to maybe stop at at neutral. 2 up, 1, and slowly down. With mid-portion Achilles tendon, you can actually go down and up and eccentrically down, and then the isotonic one where you go up, up, and slowly. 12 to 15 repetitions, and use a jump stretch. Then what you can do is to start off doing the energy storage, energy release. So the first one will be energy storage. So we're going to do a bilateral up, come up and drop and catch, and bilateral up and eccentric deceleration. Stop the downward momentum as fast as possible. And the difference in insertion tendinopathy, for insertional tendinopathy, don't go all the way down and progress to the point where you will go eventually all the way down to get accustomed to that compression forces over your calcaneus area. Then 2 up and drop it and catch it. So now energy storage and release. So this will be more an explosive type of movement, as quick as possible. Up and drop, and up and drop, and you can progress this one to a little smaller little jump. Up and drop and catch it. Okay, try to use that energy storage and release plyometric concept. Quite effective. Can you do it here? So push with your big toe in, get that calf to work really hard. Drive through the ground, come up, catch it in the middle and down. You can actually decelerate it for 1 second as introducing it into the beginning, into your program. So can you see with minimal equipment, you can actually do a lot of Achilles tendon, isometric, eccentric, energy storage and release plyometric training to prepare the athlete, to prepare that Achilles tendon for higher radical order capacity loads that's going to come through running or cutting or pivoting.